Yeah, so the GOG 213 is a multi-year project that had essentially two primary objectives. The first one was to evaluate the role of bevacizumab added to paclitaxel and carboplatin in patients with platinum-sensitive recurrent ovarian cancer. And the second objective was to evaluate the role of secondary surgical cytoreduction in the same patient population. And the two trials were very important because they were answering two different questions, but in some respects they're interrelated. So in the first question, first hypothesis was around the use of bevacizumab in that frontline setting. What we found was that it did in fact increase progression-free and overall survival. And in that process of doing that part of the study, about 107 patients, or about 14% of the patients enrolled on that trial, were also randomized to surgery. Once we had met the objective target accrual for the objective number one, the trial was amended to allow for physician's choice chemotherapy after surgery, and all patients that were considered eligible candidates for surgery then randomized to surgery or no surgery, and then to a physician's choice of adjuvant chemotherapy. So what we found, first of all, was that the patients that were actually selected for surgery had undergone a relatively high rate of what we call complete gross resection, which is that all visible disease was able to be resected at the time of surgery. And that's an important parameter because we've documented previously and now have confirmed in now 3 prospective randomized trials that patients that are taken to surgery and do not have a complete resection actually don't benefit at all from the procedure, and in some cases look like they do worse than if they had ever been had gone to surgery at all. So there's a definite negative for not being able to achieve a complete cytoreduction, which places the premium on patient selection. And so in